Imagine standing on a blade's edge for 14 hours straight. Your feet are numb. Your back feels like it's breaking. 1 millimeter too far to the left, and your patient bleeds out in seconds. 1 millimeter to the right, permanent paralysis. And this isn't a thriller movie. This is reality. Meet Jackson. He is in his final year of his medicine and surgery bachelor's. Graduation is just months away. The long nights of memorizing anatomy are nearly over, but a much bigger, terrifying question has been keeping him awake. What comes next? Walking through the hospital wards during his late-night call shifts, Jackson noticed something fascinating. Every surgical specialty has a distinct personality, but a few select departments didn't just house doctors. They housed iron giants. The specialties with the longest training, the most brutal, chaotic hours, and emergency calls that can tear your life apart at any second. Today, through Jackson's eyes, we are counting down the top 6 most difficult, grueling specialties in the entire world of surgery. Jackson's first stop on his mental journey is a room where time seems to slow down. Plastic and reconstructive surgery. Forget what you see on social media. This isn't about Hollywood nose jobs. We are talking about integrated reconstructive surgery. Jackson watches a senior resident meticulously reattaching a severed hand, connecting blood vessels thinner than a strand of human hair, using sutures you can barely see with your naked eye. The integrated program requires 6 to 7 years of brutal residency right out of medical school. The burn victims, catastrophic trauma, and microvascular free flaps don't wait for office hours. These operations routinely cross the 10 to 12-hour mark under extreme mental strain. For Jackson, the sheer technical precision required here makes it clear why this is a lifestyle killer. Next, Jackson remembers his rotation in orthopedic surgery. If plastics is a microscopic poetry, orthotrauma is high-octane engineering under immense pressure. A mandatory 5 years of co-residency, almost always followed by a hyper-competitive 1 to 2 year trauma or spine fellowship. Orthopedic trauma surgeons face a never-ending barrage of high-speed motorcycle crashes and shattered bones. Jackson recalls a night shift where the ortho team spent 6 hours straight, slammed with emergency calls, physically hammering rods into a fractured femur while wearing 15 pounds of heavy lead radiation aprons. It is physically exhausting, fiercely competitive, and absolutely relentless. As Jackson walks past the main emergency bay, he bumps into a general surgery team. This is the bedrock of the hospital. Many medical students think general surgery is just a stepping stone, but the reality is staggering. A base of 5 years. But if you want to take complex cancer resections in surgical oncology, add another 2 to 3 years of fellowship. That's up to 8 years of post-grad training. General surgeons are the ultimate firemen of the hospital. Perforated ulcers, acute abdomens, and severe trauma. They easily clock 80 to 100 hours a week during residency, holding pagers that scream for attention every 20 minutes. Jackson realizes that to survive general surgery, you don't just need stamina, you need a mind that thrives in absolute chaos. Now we enter the top 3, where the stakes reach a boiling point. At number 3, we have vascular surgery. Jackson records a lecture on the silent killers, aneurysms and acute limb ischemia. Vascular surgeons own the entire highway system of the human body. Either a 5-year general surgery track, plus a 2-year fellowship, or a dedicated integrated 6-year program. This specialty has one of the highest rates of emergency calls. When an abdominal aortic aneurysm ruptures, the patient has minutes to live. The vascular surgeon is called out of the bed at 2 a.m., knowing that if they don't clamp that aorta instantly, the patient dies on the table. Jackson notes that the emotional weight of saving limbs and lives under tight time limits makes vascular surgery an elite, exhausting pact. Number 2 takes Jackson to the absolute frontier of high-stakes medicine, cardiothoracic surgery. And if you narrow it down to pediatric cardiac surgery, the difficulty scale shatters. The traditional route takes a crushing 7 to 9 years of postgraduate training, 5 years general surgery, 2 to 3 years cardiothoracic, plus 1 to 2 years for pediatric specialization. You are operating on a heart the size of a walnut inside a newborn baby. There is zero margin for error. The work hours are notoriously punishing, often averaging 90+ hours a week, with post-operative patients who can destabilize in seconds. Jackson looks at the CT surgeons and sees individuals who have essentially signed away their personal lives to keep the hearts of others beating. Finally, Jackson arrives at the summit, the undisputed king of long training and heavy lifestyle demands, neurosurgery. Operating on the brain and spinal cord requires an absolute superhuman level of discipline. One microscopic slip, and you take away a patient's ability to speak, walk, or think. Neurosurgery holds the record for the longest standard residency in the world, a mandatory uninterrupted 7 to 8 years. Brain aneurysms, massive strokes, and severe head trauma mean neurosurgeons are essentially married to the hospital. Their call schedules are legendary for being brutal, routinely keeping residents awake for 24 to 30 hours straight, balancing extreme micro-precision under devastating fatigue. For Jackson, looking up at the neurosurgery residents is like looking at astronauts, highly trained, intensely focused, and operating in the realm where the cost of a mistake is absolute. 6 incredible fields, 6 paths of elite endurance. The question for Jackson, and for every future doctor watching this, is simple. Are you ready to pay the price to become an iron giant?